So, your doctor has brought up magnesium sulfate, and yeah, it's totally natural to feel a little overwhelmed or even scared. But that's exactly why we're here. In the next few minutes, we're going to swap out that uncertainty for some real clarity. We're going to walk through what this treatment is, why it's so important, and what you can really expect step by step. First up, we'll get into the risk factors that might lead you here. Then, we'll dive into why this stuff is considered the gold standard. We'll talk honestly about what it feels like to be on it and the amazing safety systems hospitals have in place. We'll also clear up the big one, the difference between normal side effects and the rare issue of toxicity. And finally, we'll cover what happens after your little one makes their debut. Okay, let's just jump right in. The first question on pretty much everyone's mind is, why me? Why do I need this? And the answer really comes down to your personal risk of developing high blood pressure disorders during pregnancy, especially a condition called preeclampsia. Your medical team is basically like a detective, looking at a whole bunch of clues to figure out your risk. You can see they're split into two groups. On the left, you've got the heavy hitters, the high-risk factors. If you have just one of these, like you've had preeclampsia before or you're carrying twins, that's enough to put your team on high alert. Then on the right, you have moderate risk factors. For these, it's usually a combination of two or more. Say, if it's your first baby and you're 35 or older, that raises the concern. Okay, so let's say your risk profile is on the higher side. Why is magnesium sulfate the go-to answer? This gets us to the most important part of this whole thing, what this medication actually does and what it's trying to prevent. The number one mission here is to prevent something called eclampsia. To put it simply, eclampsia is when the high blood pressure from preeclampsia gets so severe that it can cause seizures. And these are incredibly serious, life-threatening events for both mom and baby. That's why preventing them before they can ever start is the absolute top priority. And look, when it comes to prevention, there is zero debate in the medical world. The leading authority, the American College of Obstetricians and Gynecologists, or ACOG, is crystal clear. Magnesium sulfate is the drug of choice. It has been proven time and time again to be the most effective thing we have to stop these dangerous seizures. Now, this is a huge, critical takeaway, so I really want you to hear this. A lot of people think magnesium sulfate is to lower your blood pressure. It's not. You'll probably be on other meds for that. The one and only job of MAG, as everyone calls it, is to be a bodyguard for your brain. It calms down your central nervous system to protect you from having a seizure. So how do you get it? It's a two-part process, all through an IV. First, they'll give you what's called a loading dose. It's a bigger, faster dose over about 20 to 30 minutes. And the whole point is to get the magnesium levels in your blood up to that protective zone really quickly. Right after that, they'll switch to a slow, steady, continuous drip to keep you in that safe zone. All right, let's talk about what this really feels like. It's so important to be honest about this because for many women, this is the hardest part of the experience. And however you feel, I want you to know it's completely valid. This slide is perfect for knowing what's totally normal and expected. That first loading dose, whoosh. It usually brings on this sudden, intense wave of heat that spreads all over your body. It's also super common to feel nauseous, foggy-headed, and just completely exhausted, kind of like you got hit by a truck with the flu. Why? Because magnesium is a muscle relaxant, so it's telling your whole body to just chill out. It feels pretty awful, but it's actually a sign the medicine is working. And hey, that's not just a clinical description. Listen to this. It's a quote from a mom on Reddit who went through it. She says she felt half blitzed from the side effects and that it slowed down her labor. Hearing these real experiences is so important because it prepares you for how tough it can be and helps you advocate for yourself with your nurses. I know, hearing about those side effects can be a lot, which is exactly why we need to talk about the incredible safety net your hospital team builds around you. I promise you, you will be watched like a hawk. Your nurses are going to be in your room constantly doing a series of checks. They'll count how many times you breathe in a minute, check your oxygen levels, and very importantly, they'll check your reflexes. Yep, that classic little tap on the knee. They'll also be measuring how much you're peeing every single hour because your kidneys are doing the work of clearing the magnesium. Every single one of these checks gives them a direct look at how your body is handling the medication. And all this checking isn't just random. As you can see from a clinical chart like this, it's all part of a very strict, proven safety plan. Your care team is following a playbook. Every check has a purpose, and they're trained to spot the tiniest change. All that monitoring leads us straight to probably the biggest fear people have, What's the difference between just feeling the yucky side effects versus having the very, very rare problem of magnesium toxicity? Okay, this table is everything. This is your peace of mind. Look at that top row. That's the goal, the therapeutic range where you're protected even if you feel crummy. Now, look at the next line down. The very first warning sign that the levels might be getting a little too high is your reflexes start to disappear. That's it. That's the canary in the coal mine, and that is exactly why your nurse is tapping your knee every hour. It lets them catch a potential problem way before it could ever become serious. And here it is, the single most reassuring thing you need to know about this entire treatment. In the super rare case that your levels do get too high, there is a direct, fast-acting antidote called calcium gluconate. It's ready to go at a moment's notice. They can give it right through your IV, and it works quickly to reverse the effects. It's the ultimate safety valve. Okay, deep breath. You did it. Your baby is here, safe and sound. But your journey with magnesium sulfate isn't quite over, and it's really important to know why it continues even after you've given birth. You'll typically stay on the magnesium drip for a full 24 hours after your baby is born. And the reason is simple. That risk of a seizure, while it drops way, way down, it doesn't just hit zero the moment the baby arrives. This final 24-hour stretch is just to make absolutely sure you stay protected. So all that close monitoring will continue for those 24 hours. And here's something new to know for your baby this time. Because the magnesium does cross the placenta, your newborn might be a little extra sleepy or even seem a bit floppy right at birth. Please, please don't panic. This is completely normal and expected. It's just a temporary side effect that will wear off as the medicine naturally leaves their little body. So once you understand the why behind the hot flashes, the what behind the reflex checks, and the how of the whole safety system, it changes the game. It stops being this scary thing that's happening to you and becomes a process that you're an informed part of. Hopefully you now feel empowered with knowledge. So the only question left is the one on the screen. What questions are you going to ask your care team?